Fatima Rehman. I'm working as a developmental behavior pediatrician at University of Child Health Sciences Children's Hospital, Lahore. I did my research project on parenting practices and aggression in children with behavior disorders. And in behavior disorders, I declare I have no conflict of interest along with other authors. In behavior disorders, we took children with autism spectrum disorder. We included parents of children with attention deficit hyperactivity disorder and children with the social communication disorder. We know from literature that parenting styles affect the outcomes, behaviors, like general behaviors in children through research. But there's much less literature, especially local literature, when it comes to children with behavior disorders. And that's why we aim to explore this particular area. We know that parenting style is a major factor that directly and indirectly affects the psychosocial development of children. Children with disabilities are especially at risk for cognitively and emotionally neglectful parenting, and ineffective parenting styles affect children outcomes negatively and increase their problematic behaviors when we talk about normal or typically developing children. And parenting styles can be positive, they can be negative, and we'll come to that, what parenting styles we explored. So when it comes to behavior disorders, we know from literature that parents of children with attention deficit hyperactivity disorder are more likely to use negative control strategies because of their hyperactivity and impulsivity. They are more likely to use harsh discipline strategies. They show low levels of parental support. They engage in poorer quality of strategies during problem-solving tasks because that's where they need more attention and more focus. Parents of children with autism spectrum disorders they're overprotective about their children, and they have more controlling parental behaviors, hence giving them lesser choices. And they have decreased parental warmth because I think they're exhausted and stressed themselves. And this is in the literature as well. When we talk about aggression and behavior disorders, we know from literature that 35 to 50% of children with autism spectrum disorders have aggression, and about 54% children with the attention deficit hyperactivity disorder show aggressive behaviors. Aggression in these children with behavior disorders is mostly reactive rather than proactive. So it's not a well thought process. I don't know why it just keeps on shifting. But anyway, so it's often reactive as a reaction, emotional reaction to something they have experienced. And it's often associated with self-injury, problems with their sleep, communication, sensory function, and social function. So our study's objective was to explore the relationship of parenting practices with aggression in children with the before mentioned disorders. It was a cross-sectional study design, and 83 children were enrolled through consecutive sampling between 3 to 12 years of age. And children with severe developmental delay, cerebral palsy, visual or hearing impairment as a comorbidity, or chronic conditions like asthma, cystic fibrosis, etc. were excluded. For our assessment purposes, we used two tools. The first is multi-dimensional assessment of parenting scale, the MAPS, that assess the parenting practices in our group of children. It was based on, it was an interview questionnaire that was filled, and it assessed positive and negative parenting practices. When we talk about positive parenting practices, we saw, we had questions about proactive parenting, positive reinforcement, warmth, and supportiveness. And when we talk about negative parenting practices, the tool assesses hostility, lacks control, and physical control. And the tool has a good internal consistency and reliability. To assess aggression, we use the modified overt aggression scale, which assesses aggression on a scale of 0 to 40 and assesses verbal, physical aggression towards self, which is autoaggression, and aggression towards property. Higher scores indicate higher aggression. We did collect demographic data, and I'll just come to this slide. So most of our patients were children with autism spectrum disorder. The male to female ratio in our study was 3.6 to 1, which is true when it comes to autism, which is 4 male to 1 female when it comes to global prevalence. And then another thing of note is that 20% of the parents had some history of psychological illness in the family. If you look at the correlation table, you can see in column number 3, 4, generally if you see that all parenting practices had an effect more on autoaggression. So aggression towards self, which is kind of what we talked about when I was talking about the literature review, that self-injury is reported. So autoaggression was related with the parenting practices, and then there was a positive correlation of number 10. So that's negative parenting practices like lax control and physical control. So having no rules at all at home or having excessive physical control contributed negatively towards aggression and behavior problems in children. So this is another table with multiple regression analysis, and this shows that supportiveness and positive reinforcement had a significant impact on autoaggression and verbal aggression, and lax control and physical control out of the negative parenting practices had a significant correlation with total aggression and physical aggression. So if I sum up, let me just go back one another place. So maternal education was another thing, that low maternal education and lower income families, they had an effect on total aggression as well. So if you see column 3 and 4, so lower the education rate of mothers and lower the income status, socioeconomic status, more the aggressive children. And that just shows the family dynamics and how they play a part in contributing towards aggression in children with behavior disorders. So low income and maternal education is a risk factor for aggression in children with autism and ADHD, as supported by other studies. And then positive parenting, it not only reduces maladaptive behaviors, but it also improves family functioning. Positive parenting also reduces parental stress. That also contributes to positive behaviors, and it stimulates child development. Physical control, inconsistent parenting, lax control, and overprotectiveness, they are also associated with aggressive behaviors in children with autism spectrum disorder. I just put these two pictures to emphasize that even though as adults we know most of the things, we know what is right and wrong, but it is so important to give children choices so that they learn to make independent choices. They have better problem solving skills. There was a question in MAPS questionnaire that, do you give your children choices? And most of the parents replied no to that question. And I asked them, why don't you give them choices? They said, isko to samajh hi nahi aati hai. But once you start working with children with autism spectrum disorder and you start giving them choices, they are able to make those choices, which benefits them in regulating their emotions, in developing self-confidence, and then making choices later in life as well. So just thinking that a child with disability is unable to make a choice is not depriving them of their right of basically making a choice. And then I think that this also applies to typically developing children, that in Pakistan I've seen most of the times we have children who are self-feeding late, who are toilet trained late, who don't change their clothes, not because they don't know, because we do not empower them to do those tasks. हम खुद से बच्चों को फीड करवाएंगे, हम खुद से उनके कपड़े चेंज करेंगे, हम खुद से उनको नहलाएंगे, तो वो चीज़ें बहुत लेट करते हैं जो दूसरी उन्हीं के एज के बच्चे दूसरे ममालिक में बहुत जल्दी कर लेते हैं. तो टू मेक देम इंडिपेंडेंट, इट्स इम्पॉर्टेंट to give them the opportunity to do some tasks themselves and be patient with them. So in conclusion, positive reinforcement improves aggression and reduces self-injurious behavior. Negative parenting practices are associated with aggressive behaviors. Behavior in itself of parents is important to modify problematic behaviors, be it children, typically developing children or children with behavior disorders. And we need to develop strategies that target parent-child interactions and focus on developing positive parenting skills. I would like to thank my mentor, Professor Dr. Shazia Maqbool, and my co-authors. And this is just the last slide from our hospital's learning center, which is a 2 hours learning program where we enroll children with disabilities and prepare them for inclusion. And once they're able to, they go to inclusion. If they're unable to and still do not meet the criteria of school, we transfer them to a 4-hour learning center within our hospital. And then from there, we try for inclusion again, or else they stay in 4 hours learning center. Thank you. Ji, so we did not explore this area. Like we did not ask parents, but we know from literature review that when you have low income, you have lesser resources, your parents' mental health is affected, and that's why you are lesser able to implement positive practices on your children. So अगर आप अपने basic चीज़ों के लिए struggle कर रहे हैं, so there's lots of literature on that. If you're struggling for your basic necessities, then it is going to affect your emotional health, and when your emotional health is affected, it is going to affect how you parent your kids. तो चाहे वो टिपिकली डेवलपिंग हो या चिल्ड्रन विद बिहेवियर डिसऑर्डर्स में ज़्यादा देखा गया है अमूमन बनिस्बत नॉर्मल के. वो इसलिए क्योंकि बिहेवियर डिसऑर्डर्स वाले बच्चों को हम बदतमीज़ की कैटेगरी में डाल देते हैं. हम कहते हैं ये बदतमीज़ बच्चा है. हम ये नहीं कहते ये ADHD है. हम ये नहीं कहते ये ऑटिज़म है, इसके साथ ये मसला है, ये रेगुलेट नहीं कर सकता अपने इमोशंस को. हम कहते हैं ये बदतमीज़ बच्चा है. अगर हम पे एज पेरेंट्स नहीं कहते तो हमारे आसपास वाले कह देते हैं. तो वी आर मोर लाइकली टू एग्जिबिट नेगेटिव पेरेंटिंग प्रैक्टिसेस.
What are the basic, or maybe for a child of having this ADHD or a child who is having autism, as a teacher or as a parent or as a working woman, what are the significant key factors that I should consider, or I should consider that child is having an ADHD or autism? What are the key factors? Like, how do they behave? Because when we talk about these, you are well professional. So for me to understand autism, what are the factors? Like, how does it look like? And for ADHD, what does happen actually? Thank you. A quick
Ji. So I'll just be very quick and brief with this one, even though it's like a very vast thing. But still, I think that we need to have a low threshold for suspicion of a behavior disorder. But at the same time, we should not overdiagnose. I see so many children. एक मदर जो है वो हमारे पास प्राइवेट क्लिनिक में आई कि मुझे आप एक लेटर लिख दें कि मेरे बच्चे को ऑटिज़म नहीं है. इससे मैंने चेक करवाया और मैंने कहा इसको ऑटिज़म नहीं है. उसने कहा मुझे लेटर पे लिख के दें, बच्चे को हम स्कूल में नहीं एडमिट कर रहे. वो कह रहे हैं कि आप पहले लेटर लेके आएँ. तो you are right as someone from education department to refer a child, but there has to be a line where you decide you're going to take this child or not. So you are discriminating basically. That child did not have autism. Ab aajkal, if you start reading about the effects of screen time, the screen time, it's in itself makes is contributing towards hyperactive behaviors in children. Is contributing towards autism-like features. Even like normal pediatrician के पास वो बच्चा जाएगा तो वो उसे autism label कर देगा. लेकिन जब वो हमारे पास आएगा and when we explore कि अच्छा इसका 6 to 8 hours screen time रहा है 6 months से लेके 2 years तक, तो फिर we say no, this is not autism. Let's enroll him for 6 months. Let's stop the screen time. Let's give him positive parent interaction, and then we move forward. तो आपके लिए यह है कि have a low index of suspicion. ऐसा बच्चा जो difficulty face कर रहा है to cope with his daily living because of his behaviors, I'll have a high suspicion of index for him. ठीक है. लेकिन अगर एक बच्चा हाइपर एक्टिव है, ऊपर छलांगे मार रहा है, नीचे छलांगे मार रहा है, 3-year-old यही करेगा. This is pretty normal. 4-year-old भी यही करेगा. लेकिन वो स्कूल वर्क भी अपना ख़त्म कर लेता है, तो वो ADHD नहीं है. ठीक है, तो ये चीज़ हमने देखनी है एंड इट्स ऑलवेज कि आपको जहाँ सस्पिशन है तो आप रेफर ज़रूर करें उसे टू गेट फॉर्मल कंसल्टेशन, क्योंकि बहुत दफ़ा दो एंड्स हैं। एक एंड ये जो मैंने आपको बता दिया कि गलत आप ओवर डायग्नोज करके स्कूल में ही एडमिट नहीं करते बच्चे को, दूसरा एंड घर पर होता है कि बच्चा 2 साल का हो गया, बोल नहीं रहा, लेकिन आपके तो ये बोल पड़ेगा। तो एक स्पेक्ट्रम ये है। सो अ चाइल्ड इफ ही डज नॉट हैव अ सिंगल वर्ड स्पीच एट 15 months of age, you should be worried. You need to get this child to someone to assess. तो ये चीज़ें हैं कि आप नॉर्मल जो डेवलपमेंटल माइलस्टोन्स हैं उसके रेड फ्लैग्स देखेंगे।
बच्चा मुख्तलिफ वेरी करता है ना, वेरी करता है और माहौल पे डिपेंड करता है। और बात जो सिंगल रह में सेपरेट फैमिली में, उसमें ये होता है कि वो अगर एज से हो सकता है तो इसमें थोड़ा मुश्किल है, लेकिन कमांड फैमिली में रह के भी अगर वो नहीं कर रहा आपको फर्क कर दीजिए।
जी, इसीलिए 18 months पे चेकलिस्ट हम कहते हैं कि आपने एक चेकलिस्ट करनी है, और 18 months के ऊपर अगर बच्चा नहीं बोल रहा है तो यू नीड टू कंसल्ट। डोंट वेट टिल 2.5-3 years.
I just want to add one thing in general. Assalamu alaikum everyone. My name is Faryal. I'm an educational psychologist and I'm from Karachi. So basically, lovely presentation. Thank you so much to all the participants over here. But Karachi में 2018 में I was the only special educator in my entire IBA batch for ECD course. And the questions mainstream school teacher had was so much कि मुझे 2 दिन के लिए बोला गया कि अब तुम पूरी क्लास लो और इनको बताओ कि डिसलेक्सिया में क्या क्या होते हैं, ऑटिज्म में क्या क्या होते हैं और ADHD में क्या क्या होते हैं। Why? Because डाउन सिंड्रोम तो देख के पता चल जाता है, but you can't find. And the criteria of misdiagnosis in Karachi is so high.
जी, that's true everywhere.
It has scared parents to the core. इतने एंशियस पेरेंट्स हमारे पास आते हैं 1.5 साल के बच्चे को लेके कि इसकी तो दादी कह रही है तो बोल नहीं रही, क्या करें। और मेरे पास आई है, मैंने एक चार्ट खोला, थोड़े से कलर दी, वो शी वाज बैबलिंग, शी वाज सेइंग मामा बाबा चाबी। मैंने कहा व्हाट आर यू एक्सपेक्टिंग फ्रॉम हर, शी इज ओनली 15 months old, 3 वर्ड्स तो बोल रही है वो, नहीं इसकी दादी कह रही है घर की पहली बच्ची बोल रही है। मैंने कहा अगर शी डज नॉट स्पीक इन नेक्स्ट 3 months ऑल्सो, प्लीज कम बैक टू मी, डू नॉट गो टू एनी अदर डॉक्टर। इसके ओरल एग्जामिनेशन करेंगे,
टंग टाई कर देंगे,
टंग टाई कर देंगे। मैंने कहा यू हैव ब्यूटीफुल एक्टिव बेबी, प्लीज टेक हर बैक। फिर कभी कभार अगर हम 3-4 महीने बाद उनसे बोले तो फिर उनकी अम्मा बोलती है इतना बोलते चुप ही नहीं करते, बोलते रहते।
ट्रू,
बट misdiagnosis concept in Karachi is so high that this is the reason that we are only till now we are only working on awareness creation.
Yes,
specifically in mainstream school for early education teachers, so they at least can recognize the indicators, but even then we reinforce again and again that you cannot label them until and unless in 4 लोगों के through वो जा चुके हैं। So I think this is a practice which should be a part of our academic.
बिल्कुल। And if one thing you want to change ना, तो start giving awareness, और उसमें सबसे बड़ी awareness है screen time. टेल मदर्स के मत दिखाएं अपने बच्चों को टीवी मोबाइल, क्योंकि पेरेंट्स के अंदर बहुत ज़्यादा टेंडेंसी है बिकॉज ऑफ लैक ऑफ अवेयरनेस कि बच्चा बैठना शुरू हुआ तो सामने टीवी लगा के बैठा दिया। क्यों? क्योंकि वो पोएम्स को एंजॉय करता है, वो पोएम्स में झूमता है,
एंजॉय भी करता है,
फिर
और मदर जो है वो सेफ साइड पे,
हाँ कि अब ये क्रॉल करके किसी स्विच में हाथ नहीं लगाएगा, ये जाके कोई टेबल से ग्लास नहीं पकड़ेगा। तो we need to make them understand and educate them that how it is playing with their brains.
So parenting matters a lot.
जी बिल्कुल।